A new international study led by the University of Arizona looked at likely sources for the COVID-19 outbreak. The research is based on health records and genomic data from the earliest days of COVID. And our next guest, Michael Warby, is a U of A researcher who led the study. And it's good to have you here. Thank you so much for joining us. So this basically, you're trying to figure out, is it the wet market? Is it the lab? Is that what we're talking about here?
Yeah, we're trying to figure out where it came from, look at every possible hypothesis, and this is actually the culmination of years of work and quite a few studies, a lot of them that came out of my lab and with my collaborators. And in this case, we were able to kind of have the the kind of data that we dreamt on early in the pandemic about, if you have genetic material from this particular place, what story is going to be told by the not just the germs there, but the background in terms of what animals might have been there.
Okay, and this is this food market in China. They included the selling of live animals, and your report found that some of those mammals had the COVID virus and transferred? What did you find?
Sure. If you don't mind, I'll give a really quick background on this market and the evidence to date before our study came out. So this is called the Huanan seafood market, but that was really a bit of a misnomer. It sold all sorts of things, including, it turns out, it was one of just 4 places in town selling the kinds of live exotic mammals that brought us the first SARS virus. So things like civets and animals called raccoon dogs. And at first, the Chinese government was pretty assertive and said, look away here, nothing to see. These animals weren't being sold there. But we were able to show a bunch of lines of evidence that suggested that of all the places in this city of 12 million people, it's very suspicious indeed that the first cases start appearing at people who work there, and folks who don't work there, the earliest cases are still people who live around this market. What this study was able to do was use information that was generated by the team from the Chinese CDC the day that the market was closed on January 1st, 2020, where they swabbed surfaces from, doors, walls, but also things like animal cages and carts, and then sequence the heck out of all the genetic information in these samples. And then you can look at, okay, where's the SARS-CoV-2, the COVID virus? Which animals were there, and what's the relationship?
And so when you got all this information, the market was a hit, and the report found that maybe a woman working at the market might have been the first COVID virus. I mean,
it's an interesting thing that when you have a virus that doesn't land most people in the hospital, the earliest cases that we know about, they're never going to be the very first people who are infected. But yeah, we do have, the earliest known case is probably a woman who worked in, I know exactly which stall that she worked in. And
wow.
She actually herself said, I think I got this virus from sharing a bathroom with the guys selling these live animals.
Wow.
And so there's all sorts of funny clues beyond just the science that we can look at here.
Okay, so you got that on one side. There are people who will claim forever that it came out of a research lab in China. You're basically saying that's the no-go. That's done, right?
And I have no problem with anyone entertaining that hypothesis. And in fact, I was one of the scientists who early on was saying to my colleagues, and in fact, I initiated a letter by scientists that was published in a prominent science journal saying, listen, it's too early to call. We need to take this possibility seriously as part of the responsibility that we have as scientists. That letter then actually prompted the Biden administration to do their 90-day intelligence review. So I've been there, but what I did after that point was looked at the evidence that we didn't have at the time, but then unfolded through time. And what you see is a couple of things. First of all, the real coincidence is with this market. The early cases are not folks who worked at that lab or lived around it. They're folks, it would be like if there was an outbreak of an exotic virus in and around the one pet store in Phoenix that sold raccoon dogs and civets. And I started with this thought that, but it is a weird coincidence that there's a lab that studies these viruses in this city.
Yes.
And so anyone out there who's listening and thinking that same thing, I'm right there with you. That's something that we have to look at. But every city in China has a lab that you could point to after the fact like that.
And so bottom line here, and Michael, thank you so much for your time. This is absolutely fascinating. Bottom line, this really does mirror the SARS virus that came a few years earlier, correct? Or
It really does. It really does. And it's telling us that nature and these animal markets operate at biosafety level 0. We're being bombarded by very dangerous viruses all the time, and we need to think about what actions to take to stop that risky practice.
Great information. Again, Michael Warby, University of Arizona, congratulations on the research and the study, and we appreciate your time.
Thanks for having me.